but hopefully those number of circumstances will reduce as time goes by. I don't know what JP thinks about that.
No, I think you're right. I mean, again, I think there is a much bigger focus now on inappropriate use of steroids. And I think there's a recognition that, for too long, we've been using steroids for 70 years in IBD, and I think I would agree with Jonathan that they do have a role, but we need to recognise that overuse of steroids is an issue, and it has been an issue for a long time. Where I see steroids still having a role is in things like admission avoidance, preventing people coming into hospital when they've got severe symptoms, and sometimes they will have a role in that, and buying you some time to get them onto a more effective treatment that is going to get you into remission. And there's evidence that they have a role in severe acute colitis and preventing patients needing surgery as a consequence of that. So while they aren't they're clearly not a long-term solution for people, I think they will still have a role. But the days of us giving people multiple courses of steroids before they subsequently earned their next step up the therapeutic ladder, I think is hopefully changing, and hopefully that's in the past. And we've got good data recently that supports early treatment, early effective treatment in our patients is better for them. They'll do better. And so, patients shouldn't really be having multiple courses of steroids before they get on to something else. But yeah, I think they will still have a role. There are other alternatives. The question was about paediatrics, and again, we're not paediatricians.
Of course.
But one of the things that we, I think, have learned from paediatrics is, how useful nutritional therapy can be in our Crohn's disease patients. What I often say to my adult patients is, the standard approach in a new diagnosis, for example, or a patient who's flaring with Crohn's disease in paediatrics, is not to give them steroids. It's often to give them exclusive enteral nutrition, and that's something that we are doing more and more in adults. It's historically been something that we didn't think worked in adults, but also we didn't think adults would comply with. But I think attitudes to diet have changed, and people are keen often to avoid steroids because they can have a number of side effects. So we're seeing an increase in the use of nutritional therapy. We've been involved, and the Catherine McEwen Foundation supported studies looking at that have involved their adult population as well, and I think there's more work to be done in that regard. So I think we are trying to move away from steroids. I don't think you're going to get to a stage where steroids aren't used at all, but I think we should be aiming to limit the steroids that we do use.